When completing the female genitalia examination, I would begin by making sure that all of my supplies are in order, placing my speculum in warm water, making sure I have lubrication as needed, making sure that all of my sampling kits are in order. I would have the patient get into a lithotomy position on the examining table and making sure that they're comfortable, placing my draping so that my patient can make eye contact with me, and letting them know that they can stop the examination at any point, and then letting them know what each step will be as we go through the examination. I'll let them know where I am by placing the back of my hand on the inside of their thigh before touching them. I'll begin with the external examination of the external genitalia, looking at the mons pubis, the labia majora, minora, the clitoris, the vaginal opening or introitus, looking at the perineum and the anus, looking for any exudate, any excoriation, looking for normal hair distribution, any mites, looking for any lesions or any cankerous sores. I would then proceed to the speculum assessment. I would let the patient know that I'm going to be placing finger in the vaginal opening to assist the speculum. So with a downward motion, I would place the speculum in using my finger to create a greater opening for the speculum at a 45-degree angle. As the speculum goes in, I would remove my finger and move the speculum back horizontally as I enter the vaginal opening. Then opening the blades up slowly until I can visualize the cervix and the os, looking at the vaginal wall as I am. Then I would proceed to look for any exudate, any discharge from the cervix, looking for any lesions on the cervix or os, any discoloration. Once visualization is completed, I would proceed with gathering any samples, looking at the squamocolumnar junction and the endocervical junction, using a 360-degree technique with either whatever tool that's used at the facility that I am at. And then once I've completed gathering my samples, I will remove the blades from the cervix before unlocking the blades, and before closing the blades, I will assess the vaginal wall, again looking for any changes in exudate, lesions, or discoloration or masses. Then closing the blades, I will turn back 45 degrees before removing the speculum. And once the speculum is out, I will let the patient know we're going to proceed with the bimanual examination. I can lubricate my fingers if needed. Placing the fingers back inside of the vaginal opening, my pointer and index finger, I will use that to assess the vaginal walls, and then the cervix, doing the wiggle test, looking for any cervical pain or tenderness. I will then, pressing on the cervix and using a sweeping motion in the pubis abdominal area centrally, I will press on the cervix and feel for the uterus, and then moving towards whichever side I'm assessing. So assessing for the right ovary, I would move to the right side of the cervix in, again, a sweeping motion, feeling for the right ovary, and then to the left, feeling for the left ovary, and asking if there's any, telling the patient that it may feel slightly uncomfortable, but it shouldn't be painful. And then after that, if the uterus is not palpable, it may be appropriate to do a rectovaginal exam if the patient's uterus is retroverted. So that I would give the indications, and then we could decide together whether a vaginal rectal examination is warranted.